Alrighty. There's just another update. I went and saw my surgeon today because I haven't been feeling too well. And I saw the guy for my nose, and basically why I haven't been feeling well is just because I still have some packing up in my sinus area and whatnot, and it's just pressure and whatnot. But yeah, so that's fine. But if we had a scare and we thought that was like beginning stage of another brain leak or spinal fluid, whatever it's called. But thankfully it's not. Then we had a scare today because we thought I had DI, diabetes insipidus, but thankfully I don't have that. So we got all this good news that I don't have any of this, and then we realized we forgot to talk to my surgeon about my oncologist, I think is what it's called, to talk about the radiation. So we wait in the car, and he, basically the lady from the office talked to him or something. I don't know, but basically he personally is hesitant and, in his words, is afraid to do radiation on me because the little bit of tumor that is left in my brain is so close to my pituitary gland that if he uses radiation, it can possibly screw up my pituitary, which is not good because then I'd have to be on hormone replacements, and that worries me because it does control your hormones, your emotions, your feelings, your personality, and I don't want that. I don't know. I'm freaking out because I don't want it screwing up my personality or anything like that. But I mean, it could also screw up a lot of things too because there's a lot of things that are controlled with your body that are near and close to the pituitary gland. I don't know what to do. I don't know if the only route that we have right now is chemo, or either we could stick with this radiation and risk it, or we could do chemo, but I don't think the chemo will completely shrink the tumor. It'll kill the cells, but it won't keep it from growing. I've basically grown up in Gainesville, Florida, and the UF, they do a radiation proton therapy. It basically, as they do radiation, they give you a generous amount of protons, and it helps. And I guess it's a lot healthier than regular radiation therapy. So I have to wait 3 weeks to get an MRI done because it's extremely unhealthy and dangerous to get any MRIs or CAT scans or anything like that done right now since I just had surgery 2 weeks ago. And then after the MRI is done, we talk to the oncologist and we get to meet him and figure out what he personally thinks. But I'm just I'm at a loss right now. I thought right after surgery, start radiation, and then I'd be fine. I could stay away from radiation and not risk screwing up my pituitary gland, but then I'd have to get a surgery every year, if not every less 2 years I would have to get another surgery, and I don't want to do that. But I don't know what's going on, what's going to happen. It's just frustrating because I'm 17 and I can't do anything a normal 17-year-old can do, except lay in bed and watch TV all day. I can't do any schoolwork, I can't focus, I can't do anything. I can't get out of the house, I can't ride a bike, I can't drive a car, I can't do anything. And it's extremely frustrating. But I'm trying so hard to keep positive, but it's seriously the hardest thing ever. But yeah, so that's really all I have to say.